Welcome to the Speech Therapist's Way of Building Communication Skills in Toddlers. I'm Josie Mott. I'm a speech language pathologist who works with toddlers, and I wanted to talk to you today about modeling language. So on the last video, we spoke about one way to build your child's communication skills is to talk. And more specifically, it's to model language. So when you are in a daily routine, maybe in the bathtub, you can think of different ways to recognize opportunities to model language. And you will think of some ways to repeat some of the words you're saying. So as you're getting your child undressed and ready for the bathtub, you can say shirt off, pants off, socks off. So you're picking some words that are describing what's happening and they can repeat. So a lot of times what a speech therapist will think of will be using one word that is always the same, such as the off, and that is what you're doing, and the one other word changes. So shirt off or the socks off. And being repetitive in your modeling is very helpful to the child. So think of it in that way so that your child hears a lot of repetition. Once they're in the bathtub, you can think of some other things, washing. You can make up the song for when you want to wash the child, something like a familiar tune, maybe Baby Shark. So you can think of wash your hair, do 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 do, wash your hair, do 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 do, wash your hair. And we had talked about pausing and allowing the child to fill in the word. So you'll be providing those models, and after several models, you will pause and wait a few seconds to see if your child will attempt to fill in the word. Now, the repetitions of models are very important, and the support you're giving your child with that is very important. So not thinking right away to get a response. As a speech therapist, we're thinking we want to provide more models and have enough support before we ask the child to respond. So make sure you're giving at least 2 or 3 models before thinking they may fill in. With a song like that, it repeats anyway. So you repeat, wash your hair, do 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 do, wash your hair, do 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 do, wash your hair. So pausing slightly right before that last model may encourage the child to fill in. But again, so they heard the models. They heard 2 models before you paused to ask them to fill in. And the other thing is that we are just providing models and pausing slightly for a fill-in. We're not asking the child to answer a question. So asking the child many questions is sort of a put-off. They feel that, they're on the spot and they may not want to be asked questions. So if you're finding that you start to ask questions like, what's this? What is that? And you just keep asking questions, most likely your child will just turn away and try to tune you out and ignore you. It's okay to ask questions here and there, but providing the model of the response right after you ask the question is really what a speech therapist does. So if you want to ask, after you've modeled, wash your hair, and you want to say, what's this? You'd ask once, and then your response is the child's intended response. So you respond, hair, that's your hair. So give the response. Don't ask again. you're actually setting it up for the child to learn how to respond to a question. So you ask the question and you give the modeled response. And try not to ask too many questions. So in between, it's okay, but make sure you're not asking too many questions. It's just annoying, and the child is going to shut down, or become frustrated, or even start throwing things, which I have seen. We want to talk to our toddlers, but we don't want to keep questioning. It's annoying. Nobody wants to be questioned over and over again. And it's not teaching them anything. So questioning, what is that? What color is it? What is it? What do you have? Tell mommy, what is it? It's annoying. Also, that's not teaching anything. So when you think about it and you want to ask a question, you're waiting for that response, but you really actually haven't done anything to teach a response. The modeling that you're doing is what teaches the response. So ask the question, what is that? Oh, it's the duck. You have the duck. I see. It's the yellow duck. So give a modeled response. Think of things that you would like your child to say back, and that's the response that you give. Duck. Oh, that's duck. Quack, 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 quack. Again, don't ask too much of your child, because that is when they will pull back, and it will be difficult for them to receive the models you want to give them. So give and give more models. Keep giving. You should definitely be giving a lot more than what you're asking out of the child. So that's the difference. A speech therapist does realize how much modeling is needed, how much they need to give to that child to prepare them so that they are when they are ready to be able to respond. So you can sing songs in the bathtub. Obviously, you can work on those body parts to a familiar tune. Wash your belly, do 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 do. Wash your belly, do 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 do. Wash your belly. And you can also work on identifying the body parts. So if they look to which one you're talking about, that will tell you that your child is able to identify. And if your child is not able to identify their body parts, that's what you're doing. You're working on that. And you're helping them to recognize what you're talking about, where the body part is. Wash your hands. So you're modeling, you're showing them what your hands are, your words, hands, you're labeling it. And then when you pause, it's a chance for them to identify as well as maybe fill in. So wash your, and maybe they will look, they will give it a try. Maybe they'll say hand or whatever vocalization they make, you take it as their response, and it doesn't have to be perfect. It's an approximation, it's an attempt, so you just reinforce it and you just repeat that word, hands, so that they hear it again the right way, and it's a reinforcement. That's right, you told me, hands. So again, a lot of encouragement and making it fun. So it is important to understand how to model language in a way that will be effective. So if you say that I repeat words for my child and I label things for my child, so I'm modeling language. Well, it depends if you are providing the repetitions of words and the labels in a context and in the moment that makes sense. And if you are connecting with your child so that you are talking with your child, to your child instead of talking at your child. So repeating the words in in order to model the words doesn't mean just to say the words over and over as if you are saying cow, 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 or holding it up and trying to show your child and just saying cow. Or if, you go into your child's room and you want to model up for your child when you're going to pick the child up, talking at the child and saying up, up, up is a little different than if you get to your child's eye level, make eye contact, and feel a little connected to the child, showing the child the gesture for up and up, giving the model as a model of what you are looking for from your child, not just saying the word up, up. And again, you are feeling connected to the child. So you want to make sure the child is looking for you, and looking at you. Up, and the child can see your face and look at your mouth so that they can see how you're producing the word up. And you can give a phrase before the word and pause, maybe 1, 2, 3, up. So again, just to be more in the moment rather than just saying the words, if that makes sense. Going up the stairs, you can hold your child's hand and each step up, up, up. So you're in the moment, it's a shared experience, and that's when you're providing a model of that word because it makes sense of what you're doing. If the child is playing with a car and you want to model car, that's a nice time to do it. But be sure you're not just repeating words, car, car, car. It's not the same as giving a little bit of context and making sense of what's happening. Oh, car, go, go, car, car, go. You can repeat the word car, but give some context to it. Blue car, oh, car fast, go, car, go. So it's not just trying to repeat the same word multiple times without context. And again, it's a shared experience. When the child is playing, they're usually busy, so they may not be looking at you. But if you are narrating what's happening at the moment, then the child will feel the shared experience. If it's not in context with what they're doing, it won't be as meaningful. So if they're playing with the car and then you are looking at something else and you pick up boat, 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 and you're repeating boat, again, it's not in the moment of what's happening. You need to be thinking what your child may be thinking. And if they're looking at a car, they're thinking about the car and what's happening with that. You want to be aware of what your child is looking at and doing in that moment. And sometimes children spend a long time playing with something, and you may feel it's a long enough time and you want to introduce something else. And usually it can be incorporated sometimes, but again, you really want to follow what they're thinking when you're providing these models so that it makes more sense to them. If they're busy with the car, stick with that. Provide models that make sense of what they may be thinking for each moment. So car, car, go, beep, beep, beep. There's car. I see the car. If that's the word you want to target, and you're labeling it. In those moments, though, I usually would focus on the go, 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 beep, beep, beep. And you, again, are throwing in the label of car or the color blue car. But just repeating the word out of context is not providing a model, a good model. And your child may not attend to that. We want to model labels and give those labels to build vocabulary for the child. But again, in context and what would be meaningful. So think about it more in the moments, more in your routines, and what the child is focused on, so that you know what you should be modeling, and not just picking something up randomly, or showing pictures. Flashcards are not really something I recommend to do with toddlers. So if you're thinking, oh, I want to model a lot of words, a lot of vocabulary for my child, so I use flashcards, and you're just randomly picking up pictures and saying the labels, and repeating the labels, it's really meaningless. And a toddler is sometimes interested in pictures, and they can do that, but it's really something that is for a 3 to 4-year-old to do. And if you want to look at a book with the child and you want to see some pictures in the book and say, oh, I see boat, there's cat, meow, oh, little kitty cat, oh, pet kitty cat. You can do that and add some context to what you're looking at, and give some rich language models to what you're doing, instead of holding up a flashcard and saying cat, 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 which again, a flashcard is just, there is no context. A book can have some context to it, and the child can be interested in looking at some pictures. But more so, what you should definitely be doing is whatever's in the moment during your routines and during play, what the child is doing from moment to moment. Follow their lead.